Good afternoon, everyone. Today, I would like to share a powerful story of transformation and it's integrated into the conversation around internalized stigma. And this story is one that exemplifies our work in addressing internalized stigma among people living with HIV. So let me tell you about a young woman from Trinidad. ICW Caribbean, during the height of COVID, and even before, and for those of you who don't know, ICW Caribbean is a regional body, very informal, of the international community of women living with HIV. We would have, in collaboration with ICW North America, done a program called Common Threads. And Barbados, Jamaica, Trinidad and Tobago, and Guyana, and Suriname would have been part of this initiative. And this young woman from Trinidad, when she first joined the Common Threads program, she sat silently. Her story was so deeply buried beneath layers of stigma that she couldn't give it a voice. Her narrative, her story had to be read by another participant. And I tell this story to show it's a powerful illustration of how internalized stigma can silence and isolate persons. Today, this same woman stands confidently at international conferences, sharing her experiences and advocating for change. Her transformation isn't just a success story, but it's evidence of what structured, trauma-informed interventions can achieve. And so this remarkable journey forms the foundation of our discussion today on addressing internalized stigma among people living with HIV. And so, in order to understand the challenge, we need to look at the definitions, the manifestation, and the impact. And what do we mean by internalized stigma, and why does it demand our attention? Internalized stigma occurs when individuals absorb and accept negative societal attitudes about HIV, transforming external prejudice into self-directed shame and blame. It also affects self-image, which is also informed by the negative experiences. In our Caribbean context, this manifestation is particularly complex and is influenced by several interconnected factors. We have deep-rooted historical trauma that shapes community responses. They are the socio-economic challenges that limit access to support. They are the educational barriers that affect health literacy. There is substance use patterns that contribute to increased vulnerability. And there is exposure to violence that compounds trauma, as well as the literacy challenges that impact healthcare engagement. And these factors don't exist in isolation. We see its impact daily. We see people withdrawing from society. We see people reluctant to seek healthcare. And we see people struggling with treatment adherence. And it creates a web of vulnerability that predisposes individuals to HIV infection, and it complicates their journey after diagnosis. And so, trauma-informed approach. We know that healing requires a comprehensive, trauma-informed approach built on key principles such as creating physical and emotional safety, building trustworthiness and transparency, fostering peer support, encouraging collaboration, promoting empowerment and choice, and also honoring cultural, historical, and gender considerations. Common Threads had one of the components as body mapping. And this was a powerful therapeutic tool where participants mapped their experiences onto life-size outlines of their body. It allowed for them to visualize their journey with HIV. It also allowed for them to identify points of trauma and resilience. It also allowed for them to understand personal vulnerability factors and process the experiences. The program allowed for the creation of a safe space where the participants were able to build trust in that they could now tell their stories. They could connect with peers who understood their journey, and they could process the trauma in culturally appropriate ways, and also develop new narratives about their lives. There is also another program called Catch a Rising Star, which also complements the healing with practical skills development. And Catch a Rising Star is actually the precursor to Common Threads. And what it allows is for those, and I'm sure we would have encountered persons who are HIV positive and cannot verbalize that. And it allows for the internalized stigma to build. Catch a Rising Star allowed them to be able to verbalize. It helped rebuild their confidence and allowed for leadership training. It also helped with public speaking and allowed them to voice their experiences. It allowed for advocacy training that transformed their personal pain into community action. And those professional developments allowed for new opportunities. What they also was able to understand their capacity for resilience. And so they were able to draw on sources of strength that they didn't recognize. They also developed new ways to tell their stories, right? And so moving forward, we need to develop trauma-informed therapy programs. And unless you're in the shoes of a positive person, I cannot stress how much of a traumatic experience it is to get a positive diagnosis. We need to develop sustainable peer support networks. We need to establish protective legislation and the policy frameworks, because we do have policy, but if there is nothing to enforce those policies, then it's just words. We need legislation to support enforcement. And we need to create long-term community intervention strategies and implement robust program evaluation systems so we could understand what works, what doesn't work, and modify accordingly. In closing, colleagues, I want to say that the transformation of the participant from Trinidad, from silence to international advocacy, it represents the potential we can unlock through structured, trauma-informed interventions. And I'll leave you with the powerful words of Maya Angelou, which perfectly capture the journey of those who we support with these programs. There is no greater agony than bearing an untold story inside of you. Our Trinidad participant, she lived this agony, as do many others in our communities, but through proper support and intervention, These untold stories can become powerful voices for change. When we help people living with HIV move from silence to advocacy, from shame to strength, we don't just transform individual lives, we transform entire communities. Thank you very much.